All right, so I've been thinking about this a lot recently. We took a week off. We closed the office for the week, for the 4th of July week, and I've been thinking about this on and off, especially with Clinical Climb and the dentists who come into our office. So I want to make a video about it. Why or how do some dentists actually get good and succeed? Because a lot of dentists say that they want to grow, right? A lot of dentists say that they want to do bigger cases. They say they want implants, veneers, full arch, better consults, experiences, patient experiences, better team, whatever it is, higher production, and a practice that they love working in every single day. But only some of them actually do it. And the thing is, it's not how smart they are. I don't even think it's just work ethic, because most dentists already work hard. I think the difference is the dentists who actually get good fall in love with the process of getting better. They fall in love with the game of business and self-development. And then let me expand on this. And I've noticed this is the part most dentists forget about, where they just miss completely. Just like with anything in life, right? Everyone wants the result. Everyone wants the beautiful before and afters or the big cases and whatnot. But not everyone wants to actually put in the work for years and years into the development of themselves, and multiple 5 to even 6 figures needed to invest in that process on yourself. But that is where the growth is, right? That is where the actual work is. And I think if you're a dentist trying to get better, there are 6 things that I thought of on this break that you have to understand. And the first thing is, you have to stop chasing every opportunity. Dentistry is full of shiny objects, and dentists love chasing new opportunities, right? Someone tells you to do implants, you do implants. Someone tells you to do Invisalign, you do Invisalign. Someone tells you to do this, you do that. Someone tells you to do sleep or Botox or whatever, and you do it. And some of those are great opportunities, right? But that does not mean they are the right opportunity for you. The question is not just, can this make me money? Right? If you've ever led anything in life with money, you're never going to succeed. What you should actually lead with is, can I actually become obsessed with this? Can I care enough about this thing to get through the hard parts? Month after month after month, even years. Because if you pick something only because it's profitable or because you want to make money, but you do not care about the procedure, the process, or even love the details, eventually it's just going to become another thing that you avoid. Trust me. And that is why so many dentists take a course, come back excited, then 6 months later, nothing has changed, right? The second thing is, you have to find out what actually pulls you. Every dentist has something, right? Some dentists love surgery, some love cosmetics or whatever dental procedure may be for you. Some just love the business side of it more than the clinical side. Some love photography or teaching. And the way to find it is not that complicated. Look at what you already pay attention to every single day when no one is forcing you to pay attention to it. What cases do you think about after work? What videos do you watch? What CE actually gets you excited or makes you want to do it over and over and over again? What do you look at and think, I want to actually get really good at this? That is probably your clue, right? What you need to focus on. It does not mean that thing has to become your whole practice by tomorrow. Obviously not, especially if you're lost right now or you're trying to still figure it out. But it tells you, maybe I should go down this path. Okay. And the third thing is interest. Interest does not equate to commitment. Just because you're interested in something, it doesn't mean you're going to be committed to it for months and definitely not years. You could be interested in watching videos or interested in doing bigger cases, but actually being committed is a whole other game, from sales to workflows to actual dentistry and everything else that comes with it. Okay. Interest is like liking implants because you like the profit and because you drilled in a few implants. Commitment is understanding the planning, the surgery, the tissue, prosthetics, complications, follow-up, patient experience around it, not to mention the marketing and the sales and the patient issues. Being interested in something is easy, right? And that's why most people stay interested, but they do not actually get good or follow through completely. How you move from interest to commitment is repetition first. You need to present more cases, you need to evaluate your own work, dental and business people skills, and then do more cases. Then you'll know if you're actually committed or if this isn't really for you. And that is one of the reasons that we built Clinical Climb the way that we did. And we really place emphasis on the shadowing aspect, the aspect of you trying something out first. You need to be in the room. You need to see the day-to-day. You need to see the consultations, the new patients, the systems, the language that we use, how the team moves, how they do these little things that you're never going to get at a course. You need to see it first and realize, is this for me or is it not for me? And the fourth thing is, you are not going to love every single day. This is important. A lot of people think if they pick the right thing, they're going to feel motivated every single day, all the time. And that is not true. You can love dentistry And you can still have days where you're tired or you feel over it. You can love implants and you still hate dealing with complications or the patients. They're just drive you crazy. You can love cosmetic dentistry and you still get frustrated with all the details and all the picky patients or patients complaining over a tiny 0.5 millimeter line angle, right? And you can love the ownership and dislike so many other aspects of it. A little bit of hate is normal. It's normal in life. That does not mean that you picked the wrong thing. It means that you're doing the real version of the thing. Anything worth getting good at starts with painful, boring, frustration, or annoying things. The goal is not to love every second. The goal is to love it on average and enjoy it on average. On average, does this pull you forward? Or on average, does it make you want to improve? Does it feel like something worth building? If yes, keep doing it. If not, stop doing it. And the fifth thing is you need teachers. And a teacher does not always have to be one person standing next to you. It can be a mentor, a coach, a course, a doctor that you shadow, for example, us, or a practice that you visit. But you need something that raises your standard. Because if you stay in your own bubble, your standard becomes whatever is normal around you every single day. You can be doing fine compared to the people around you and still be nowhere close to what is possible. And that is what happens when you push yourself to see more. You see better systems, better language, better case presentation. You see better handoffs. You see better patient experiences. And once you see it, you can't unsee it. And that is the value. It changes your standard too, your daily standard, what you're exposed to. And the sixth thing is you have to build your practice along or around the long term. Because a lot of dentists build their practice around weekly survival or monthly numbers, right? Fill the schedule, do the dentistry, put out the fires, go home tired, come back and rinse and repeat. And I get it, that is real. But at some point you want to grow. You want to have a practice that becomes the environment that helps you get better. Your team should also help you get better too, right? Your systems should also help you get better. Your patient experience should help you get better every day. You need to build an environment that supports the dentist or the person that you're trying to become over the years and over the long term. So I want you to ask yourself, what part of dentistry actually pulls me? What have I been dabbling in but not really committing to? What would happen if for the next 12 months, for example, I picked one thing and I stuck to it, actually stuck to it. Not just watched videos, not just bought the equipment, not just said that I wanted to do it, but actually got the reps around the right people or got around the right people, studied the process and improved the consults and actually became better. Dentistry gets meaningful because you are building something. And that is really what we try to tell every doctor. There isn't a shortcut to it. There's no shortcut at all. It is about getting in the right environment, seeing what is possible, and doing the reps until your standard for yourself changes. Also, if that shadowing or in-office experience part stuck out to you, by the way, take a look at our in-office shadowing experience video. With all that to say, find the thing in dentistry that pulls you. Get the reps, the repetition, find the right teachers, build the environment, and learn to love the growth and learn to love the challenges.